Greetings to you, greetings to you. Good morning, good afternoon, good evening, good night, depending on the time you're watching this video. I am your friend and tutor, Mr. Chukujut. I will be learning together with you this important course, the use of national standing orders for community practitioners. Today being the first lesson, we are going to be trying to navigate the first chapter, the first topic, as a matter of fact. So I urge you to get ready, get your pen and paper ready, as you are going to be making useful notes from this lesson. Without any further ado, get set and let's move in. Alright. Okay, you're welcome. You are welcome. We are now diving into the lecture proper. I already introduced that we are looking at the historical background of the standing orders today, and then generally speaking, we want to achieve the general objective. At the end of this lesson, you should be able to understand the origin, the meaning, the purpose of national standing orders as a professional tool for community health practice in Nigeria. Specifically speaking, there are three cardinal things you must bear in mind or you must go with at the end of this lecture or lesson. You should be able to define standing orders very, very clearly without any stress. You should be able to explain the evolution of the standing orders, and you should be able to state the objectives of the standing orders. Okay, quickly let's start looking into them one by one. Okay, all right. This is 1.1.1, and then it is on the definition or the meaning of the standing orders. Here, as we all know, there's this popular definition for standing orders, the one that the standing order itself contains. Okay, it is the one that almost everyone knows, as if there's no other way the standing order can be defined. All right, but it's a good one, I must confess. It's a comprehensive definition. So let's give reference to that. It says that the standing orders, you can see me reading from here, the standing orders are a set of specific guidelines arranged by age group, disease conditions, findings, clinical judgments, and actions which define how a patient should be cared for at primary health care facility. Okay, this definition is according to the latest edition of the standing orders. It has been like that in the previous ones anyway. The standing order are usually done by the Community Health Practitioners Board of Nigeria, and as usual in collaboration with the National Primary Care Development Agency. And this is 2024 edition, even though it is like that in the previous version as well. So they define this to be a set of specific guideline, not just anyhow guideline, a guideline that is arranged or that is organized based on age group, disease condition, findings, clinical judgment, and actions which stipulate or define how a patient should actually be cared for. Okay, very simple and comprehensive definition. I have one here which I personally put forward by myself, and it is that the standing orders are officially approved written guideline issued by the Community Health Practitioners Association Board of Nigeria to direct community health practitioners on how to assess, to classify, to manage clients presenting specific complaints. Okay, all right. I also go forward or further to say that they are organized by age group, clinical conditions, findings, and prescribed actions, ensuring that every practitioner provides safe, uniform, and legally protected care within the defined scope of practice. So My definition and that one of the board, they are not saying opposite. As a matter of fact, I just try to okay define the same thing in a different way. Okay, but that is the essence of learning. You should be able to define the standard orders in your own terms, bearing in mind the key terms, the key ways. You see, every definition has key ways, and if you want to define that concept exactly, you must always bear in mind those key ingredients that form the definition of that particular concept. Okay, so for you to define standard orders in your own way and still get it very, very clearly is very possible, but then you must bear in mind these key elements. Okay, you must be able to make us understand that it is a guideline. Okay, it is a guideline. Okay, and that guideline is not just a guideline, it is an organized one. It is organized. Okay, and the organization or the grouping in that guideline is based on age group, is based on disease conditions, is based on findings, is based on clinical judgment and actions. Okay, so however you define it, in as much as you are putting these key ingredients in your definition, you are good to go. Okay, key points I wanted to bear in mind is that the standing order translates public policy into standardized clinical actions. Okay, it translates public policy into standardized clinical actions. You must bear that in mind. And then the standing order is both a professional guide and a legal instrument. Okay, both a professional guide and a legal instrument. Okay, the application of the standing orders ensures quality, safety, and accountability. If you look carefully in this definition, you're going to see that that is the direction the definition of the standing order is navigating us towards. It's making us understand that this instrument is a guide, okay, is organized, is arranged based on certain parameters, which are the age of the patient, the disease the patient or the client is presenting, okay, you see, the clinical judgment, the findings, and what action should be taken. These parameters or these variables form the basis upon which the standard order is organized or arranged. So you can define it anyhow you want to define it, bearing in mind these things. As much as you're able to blend in these variables in your definition, so you are good to go. Just tell us it's a guide, okay? But the guide is organized, it's arranged, it's not anyhow. And the arrangement follows the age of the patient, from the age of the patient leading to the complaint of the patient, from the complaint of the patient leading to the findings on examination, okay, from the examination findings leading to clinical judgment, what the case is, okay, from the clinical judgment leading us to the actions. Okay, if you're able to establish the sequence, however you put the definition, you are good to go. I want to believe we have done justice to this. Okay, so let's move to the evolution of the standard orders, which is 2.1, which is 1.2.1, the second bullet. Okay, remember we said you are going to look at the meaning of the standard order, the evolution of the standard orders, and the objectives of the standard orders. So we are done with the first item. Now we are into the second item, the evolution. I wanted to recall that evolution is just metamorphosis, the stages of development, the milestones something has undergone. Okay, it tells you that the standard orders you see today is not the first standard orders. It makes us understand that 10 years ago, 15 years ago, the standard orders is not the same thing with the standard orders we are seeing today. Okay, this instrument has been evolving, it has been developing, it has been advancing. Okay, and that is evolution. All right. So what we have here is that the standard orders evolved as part of Nigeria's effort to standardize community level care during expansion of primary health care system in the late 1970s, okay, and early 1980s. Okay, you can see this standing order of a team, began as far back as 1970. Okay, so it's not a recent instrument. All right, originally adapted from the British Community Nursing Guideline. Okay, it was originally adopted. You can see the evolution. Hmm? It started around 1970 and it actually came from British Nursing Guideline. It The first Nigerian standing orders were developed through collaboration of the Federal Ministry of Health, the Primary Care Development Agency, and the Community Personalization Board of Nigeria. Okay, since then, several revisions and updates have been made, okay, to reflect the advances in medicine, disease pattern, and scope of practice. You understand? The recent edition of the standing order we have clearly demarcated the scope, okay, of clinical practice between the three cadres, CHO, CHU, and then JHU. Specifically speaking, this table gives us the milestone, okay? In the early PAC years, that's around 1970s and then early 1980s, okay? The standing order used to be an informal clinical protocol, a kind of job aids that were used to guide village and community health workers under primary care initiatives, okay? They were often developed by teaching hospitals, Institute of Child Health, and then some early primary care programs then, you understand? So it wasn't as a sophisticated as a comprehensive instrument as it is today. It used to be one kind little clinical protocol, a job aid sort of, okay. Then around 1980, the first structured standing orders came to be, you understand? The first structured standing orders came to be around 1980, even though different literatures cite, you know, not exactly the same years, but all the citations were around that 1980. It suggests that around that time, the first structural standard order came to be. All right. Then, since then, from between 1990 and 2010, multiple update and expanded edition were produced to reflect new primary care policies, disease patterns, and scope of practices changes. Okay, the changes in the scope of practices. So between 1990 and 2010, we saw multiple expansion, multiple revision, multiple edition came to be. Okay, then later between 2010 and 2020, we also saw standing order that the our board, in collaboration with primary care organization like usual, also or reviewed. And last in 2024, we saw the latest edition, which clearly demarcate the scope of clinical practice between the two cadres we have, and eventually got launched as a mobile app, so you can now get it in your phone. You can see the metamorphosis, the evolution, how this document kept evolving and evolving and developing. Okay, all right. The evolution is actually not just based on nothing. Okay, this standing order has been evolving for certain reasons. There are some rationales behind this evolution, and they include the dynamic trend of diseases. You know what dynamic is? Dynamics means changes in disease pattern. Before now, communicable diseases used to kill more, but in the recent data, we are seeing that non-communicable diseases like hypertension and diabetes are beginning to claim more lives than communicable diseases. So these dynamics, these changes, are leading to changes in the standing orders as well. Of course, we see poor arrangement in the order standing orders. We saw unnecessary repetitions in the order standing orders. And of course, advancing training curriculum. Those who did CHU and CHO 10 years ago may not be able to do it these days because the standing order has been enriched and then advanced. So since you are advancing the scope of training, you're definitely going to advance the scope of clinical practice. So it has to reflect in the standing order. Okay, these are the rationales, the reason behind the evolution. Another one is increasing resistance of certain microorganisms to antibiotics. Okay, you see that some microorganisms over time seem to have started resisting the antibiotic they used to be sensitive to. For example, if you look at the older standing orders, you are going to understand that um, amoxicillin, for example, for an adult, 500 milligram used to be prescribed BD, that is twice at 12 hourly every day. Okay, but in the recent prescription, in the newer standing orders, you are going to notice that the same amoxicillin, 500 milligram for an adult, is prescribed 3 times TDS. Okay, that's 8 hourly. That tells you that this guy microorganism has started growing some level of resistance to this antibiotic, and so the dose has to be increased. It will get to a time that amoxicillin may not longer be sensitive enough to be used, and probably newer generation antibiotic may begin to be substituted for amoxicillin. So all these things are the reasons why this standing order keeps evolving, and it will keep evolving because you can see these variables are constant and they will keep occurring. Okay. All right. So we are coming to the last part of this class, which is the objectives of the standing orders. All right. This standing orders aims to achieve a lot of things. One, to guide committed practitioners in making correct and timely clinical judgment. See, the standing order is supposed to be like a walking stick. It's supposed to be leading you, okay? It makes you or enables you or assists you take correct decision in the correct time, okay? It promotes uniformity of care. Of course, we are all supposed to be using the standing orders so that health center in the village and health center in the town will be doing the same thing. And someone from the village will have no reason to leave the village health center and begin to go to the health center in the town. Are we together? All right. Another thing, the third bullet you can see here is to protect both the practitioner and the client. Yeah, there's an order gives you the opportunity to be operating within a legal scope. So legally speaking, your patient is safe. Legally speaking, you are protected. So it gives a kind of legal backing. Are we following? If you have any question, please do not hesitate to drop it in the comment section. I will try my best to respond to all the questions in the comment section. Okay, so do not hesitate to put your questions in the comment section. Any question you have, put it down in the comment section. I will respond to all of them. I will try to respond to all of them. I will do my best to respond to all of them. Okay. So the standing orders aims to improve quality of care. Of course, it's a standardized instrument. Use it. It will enhance your quality of care. It will enhance the outcome of your services. Okay, especially at the grassroots level. Okay, the standing order also aims to enhance supervision and ensure accountability within the primary care setting. Yes, since you have an order, you have an expected modus operandi. It makes supervision easier because if your supervisor comes to supervise you, he will supervise you based on the protocol with which you are supposed to be working. Sure you get. But if you were just working anyhow, it will make supervision difficult. Okay. Now let's proceed. A standing order also aims to support training and then continuous professional development. There's no doubt about that. It's self-explanatory. A standing order also aims to give health workers legal protection. Yes, in as much as you're acting within the standing orders, whatever happens is meant to happen. You are not legally liable. Okay, okay. But if you act outside the standing order, whatever you see, you take. Okay. The standing order also aims to provide a systematic framework for history taking and the physical examination, just like we have said earlier. With the standing orders, you don't need to cram anything, you just need to make reference to it and see what you're supposed to do at the right time, and you do that. It gives you the framework, what to check, when to check it. Okay. So these are the aims, the objectives of the standing orders. It also aims to assist health workers to manage less common, easily forgotten, and more serious condition. You remember that not every condition you see every day. For example, scorpion stings. You may work in a facility or in a hospital, and for the entire year or 2 years, you've not seen a case of scorpion stings. You are human, you are not robotic, you may forget. The next time you see it, you may not remember the treatment protocol for scorpion stings. Okay? Because this is not a common condition. But with the standard orders, you can quickly make reference to it, and then, of course, you remember what to do and you do it rightly and appropriately. Okay, so that is one of the advantages the standard order aims to give you. It also aims to maintain high and uniform standard of care. Of course, that's very similar to one of the points we made here already. The standing orders also aims to minimize unnecessary and often time expensive and time consuming laboratory investigation. Hey, hold on. Do not misinterpret this point. The standing order is not eliminating the necessity of laboratory investigation, but it minimizes the unnecessary one and often time expensive and time consuming laboratory investigations. The standing order will always tell you what to do, how to manage cases, clearly not needing any laboratory investigation. But when there is a you know valid reason for laboratory investigation, it's another will direct you to tell you check this and that and that. Okay, but Honestly speaking, the standing order minimizes frequent visits to lab. Okay, it provides a framework for evaluation, just like we see it here. It's very similar to one of the points here, that of supervision. Okay, so we have defined the standing order so far so good. We have looked at the evolution of the standing order since from 1970 to the current standing orders, the mobile app we have, and we have seen the objectives of the standing orders. And then that is the end for today's class. If you have any question, do not hesitate. Put it down in the comment section. I will respond to that. I will respond to that. Okay. Don't forget to subscribe to this channel if you're here to do that. Click the subscription button. It's free. It doesn't cost you anything to subscribe. It will help the channel to grow and become more popular. Okay. So click the subscription button in order to support the channel. Okay. So in summary, standing orders are legally approved guidelines for managing client condition at primary care level, as simple as ABCD. They evolved through Nigerian primary care reforms to ensure standardized care. Simple. Their objectives are to guide, protect, and improve clinical performance of community practitioners. As simple as that. You must not forget these key bullets. Okay? Evaluation questions. Test to self, test to self. Try to define what the standing orders are on your own. Try to describe briefly the historical evolution of the standing orders in Nigeria. Try to state 5 key objectives of the standing orders. Okay. Try to answer the question, why are standing orders considered to be legal documents for community practitioners? Try to give answers to these questions. Of course, they will definitely form part of your assessment questions. Expo. Okay. So we have come to the end of this class. I want to believe you got value from this lesson. If you do, like the video, subscribe to the channel, share this video to other students. There's nothing wrong with sharing the video with other students. It's for you, but you can share it with your good friend. Fine. The person is not paying anything. The person is learning for free. See you in the next class when we look at the next chapter, the next topic. Bye for now.